So welcome back to my YouTube channel. From today we are going to start forensic medicine series and I am going to cover up all high yield and important topics. So let's start. So today we are going to start like autopsy and what is autopsy, type of autopsies. Also we are going to talk about the post-mortem techniques, which is the most common, and also like type of incision during autopsy, what are the type of incisions, and also we are going to talk about the body cavity which can be opened first during the post-mortem, and also the exhumation, what is exhumation, on whose request it is performed. So let's begin. An autopsy is also known as post-mortem examination, okay, and is a through medical examination of a dead person to determine the cause of death and also to evaluate any disease or injury that may be present. Mostly there are few types of autopsies. So first is medico-legal autopsy, which is most common, and it is on the request of either police or magistrate, and this autopsy is done for unnatural deaths which are unnatural like murder or suicide, which can be done purposefully. So the second type is pathological and clinical autopsy. So here the relatives consent is mandatory. Mostly we can see the relatives consent is mandatory and it is done in natural deaths. So natural deaths are like, we can see the deaths by illness or any kind of pathology. Third type is psychological autopsy. So this is done in suicide cases mostly, and firstly the family members are interviewed to know the mental status. So the fourth type is virtual autopsy. It is known as autopsy. Like CT scan, MRI is performed for knowing the cause of deaths. So this is the important point where you can note CT scan, MRI is performed for knowing the cause of death. It is visual imaging technique performed in developed countries. So guys, this technique is used mostly in developed countries. The another type is negative autopsy. It is performed if there is no cause of death. Even after performing post-mortem examination, lab investigations, histopathological and toxicological studies. So prevalence of negative autopsies are 2 to 5%. In cases like vagal inhibition, laryngospasm, epilepsy, there is a chance of negative autopsies. We have talked about the types of autopsy. Now we'll continue with post-mortem techniques. So guys, the Virchow's method, which is most common, it is very common method. One by one organ is removed. So in this autopsy we can see one by one organ is removed for examination. It is very fast and easy method. Another method is Ghones or en bloc method. Targeted organs are taken out for the examination, and also the targeted areas like cervical, thoracic, abdominal and pelvic blocks are taken out. So inter-organ relations are intact. So another technique is Little's or en masses technique. In this technique, mostly the large masses are taken out and the complete viscera is taken out. It is for detection of minor bleeding. This technique is done because blood vessels and vascular supply is intact. The another method is Rokitancy or in situ method, it is inside dissection and mostly it is done in infectious disease like HIV, hepatitis and COVID-19. So you can see guys, these are the types of incision. The first is eye-shaped incision. You can see in this image there is straight line. So we have said it is like eye-shaped incision. So in another image you can see it is Y-shaped. You can see this image, it is like Y-shaped. And in third you can see it is modified Y-shape. So it is, this incision is done from the neck till thorax and abdomen. So this is modified Y-shaped. So now we will talk about why this incision is needed and where to use. So first is eye-shaped incision. So this is most common type. It starts from chin to pubic symphysis. Another is Y-shape. So the purpose is cosmetic, to preserve the mammillary line, and it starts from the acromion process and preserving the mammillary line reaches the breast, then to xiphoid sternum and to pubic symphysis. So another type is modified Y-shaped incision. Mostly this is done in asphyxial deaths, and it starts from mastoid process to suprasternal notch or then to pubic symphysis. And the fourth type is X incision. It is generally not done, like two incisions are made from the shoulder to opposite iliac crest and it makes an X mark on the body, and it is for deep and custodial deaths. It is the rarest one, mostly it is not done. So now the next we are going to talk about body cavity to be opened first in autopsy. So generally in post-mortem examination, thoracic cavity is opened first. So this is the important point you can note. In newborns, we can see the abdomen is open first because the position of the diaphragm is seen. In poisoning cases, the first cavity to be opened is cranium, like skull, because the best smell of the poison can be pursued from the brain. In asphyxial deaths, cranium, thoracic, abdomen and neck are opened in an order. Like you can go from cranium to thoracic, abdomen and neck. This is the sequence you have to perform. We want the neck as a bloodless field. Hence the last cavity opened is the neck. In traumatic head injury, head is the first cavity to be opened. In air embolism or pneumothorax, the chest cavity is opened first. Skin flap is taken out and it is filled with water. Then puncture the pleura. If a bubble comes out, the water test is positive. In air embolism cases, open the pericardium, fill it with water and puncture the ventricle. If a bubble comes out, the water test is positive. Another technique used in air embolism cases, a syringe is taken and aspirate blood from the ventricle. If air is present in the ventricle, the color of the pyrogalol solution turns brown. So now we will talk about the exhumation. What is exhumation? When to perform? On whose request it is performed? So it is done on request of magistrate in presence of police and doctor. It comes under section 176 IPC. This is done for the identify the site with the help of relatives or accused. It is done early in the morning because whole day light is required. There is no limit for exhumation. It might continue for a few days too. Soil sample like 500 grams from the body and control sample is also taken to make comparison. Bones and tissues are taken for chemical or psychological analysis. So thank you guys. These are the high yield topics from autopsies, and also the type of autopsy, the incision, which is very high yield for competitive exams. So study well and revise it properly. Thank you.